Good morning, everyone. Thank you for coming very early today. Now, I'm going to give a small discussion on hair diseases and cellular therapy to manage your hair patients. So, the hair is an essential component of all humans. It is primarily made up of dead keratinized skin. Okay? The human body is almost entirely covered by hair, except for the palms and the soles of the feet. The other parts of the body all can grow hair if there is a hair follicle present, right? So the hair plays a crucial role in appearance, social interaction, and sexual appeal. The human body has roughly about 5 million hair, okay, mostly found on the scalp. So, what are the functions of hair for the body? One is protection. It protects you from the external environment like the UV radiation. Hair is also gives you sensory input through tactile perception. It is an organ that manages thermoregulation, how it maintains your body temperature. And also for communication. It is a good form of non-verbal communication. Right, a little bit of basics on the hair. What you see in your hair above the skin is the hair shaft, okay? Below the hair shaft, there is also the hair follicle, and at the root of it is the hair bulb, okay? This is basically the anatomy of the hair. The first hair to be found is lanugo hair, okay? Lanugo hair is in utero. It develops in utero while the fetus is developing. Okay, and once the baby is born, lanugo hair is shed off and it is replaced by vellus hair, what we call baby hair that we see in children and in adults. Okay, slowly vellus hair is replaced by terminal hair, the long coarse hair we have in children and adults. Yeah, right. Hair also differs between different ethnicities. Asian hair tend to be more straight to slightly curly or wavy. Okay? If you were to see the cross section of an Asian hair, it will be rather symmetrical, round. Okay? When it goes to Caucasian hair, it tends to be more wavy than Asian hair, and the shape at cross section is more oval, whereas Afro hair tends to be more curly. The difference in this hair structure is because of the protein makeup of the hair. Therefore, when there's more protein and more bonding, the hair tends to be more curly. Okay. Different parts of the body has hair growing at different rates. Hair on the eyelashes and the eyebrows tend to grow at about slightly less than ½ centimeter a month. Whereas hair on facial hair, like the mustache and the beard, tends to grow at double that rate, about 0.8 centimeters a month. Scalp hair grows the fastest. It grows slightly more than 1 centimeter a month. Okay? This is very important when you do your hair removal therapy. When you want to know, when you want to call back your patient, okay, you need to know how fast the hair grows. Therefore, the hair removal or hair reduction practice, you know, you can decide, okay, this hair is going to grow 1 centimeter within 1 month or ½ centimeter. So I need to get that patient back within 2 months so that the hair is not visible, right? So hair grows in a cycle. This cycle consists of 3 stages. Initially, there is the anagen stage or the growth stage. This is where your hair grows, okay? After that, it will move to a catagen stage, which is a resting stage. It stays rest, not growing anymore, not growing any longer. Then it goes to a telogen phase, where the hair will be shed off. It comes off to be replaced by a new hair strand. Okay? This whole cycle averages about 5 to 6 years. Every 5 to 6 years, you change and get new hair. But it all doesn't happen at one time. Okay? So you will see different stages of hair at one place at one time. Okay? So any disturbance to this cycle causes hair disease. Okay, all hair disease happens when there's a disruption to this cycle. So as you can see here, the anagen phase, the growth phase, then it goes to catagen, it stays fixed, and then it goes to telogen. For ladies who have long hair, when the hair grows more than 25 centimeters, it tends to move to the catagen phase where there won't be much growth after that. Very difficult to stimulate growth after that, especially in adults, unless you supplement your hair. Okay? Then you go to the telogen phase and the hair drops off. And as I've said before, if you see one section of the skin, you see different hair strands at different stages of the hair cycle. Okay? Some are shedding off, some new ones growing, as you can see here, and someone is in the rest stage. So this is the most important slide for hair. You must understand the cycle. So what are the common hair problems we see? Some people complain of losing hair, other people complain of too much hair. Okay? These are the two main issues with hair. There's also another problem called canitis, where some people are not happy because they have white hair. So to put things into perspective, this is a visual aid to help you decide if you are having a problem with hair. Okay? Most patients that have hair problems or approach doctors for hair issues are ladies. They are more traumatically involved or traumatized because of hair loss. Everything on your left is still considered normal. When you wake up in the morning and you see this much of hair on your left, on your pillow, or after a bath, if you see your toilet hole having this much of hair, you are still okay, right? But when you see losing more than 150 to 200 hairs as exhibited on the right, you have a problem, right? Okay. So, generally, dermatologists like to divide hair problems into two categories, scarring alopecia and non-scarring alopecia. Scarring alopecia, as the name suggests, means that basically after the disease has resolved, the disease heals by scarring. Okay? When the hair scars, that means the skin is scarred, there won't be any more hair growth at that area. Okay? So this process means the hair loss is irreversible. Okay? So diseases where there's scarring alopecia, once the hair is lost, you can just help to reassure the patient there's no way hair is going to grow, right? Unlike non-scarring alopecia, there is no scarring. Upon healing of the disease, the skin is back to normal, the hair follicles are still intact, hair can grow. Right, so let us briefly see some common hair diseases. The first one I want to introduce is androgenetic alopecia. This is male pattern baldness. Okay? It is the commonest form of hair loss in adults. As the name suggests, male pattern baldness. Baldness meaning there is hair loss. Pattern meaning the hair is lost in a certain pattern. Okay? It's a fixed pattern. Why is it in a fixed pattern? Because this disease has a genetic predisposition. How is the hair loss? The hair loss is lost at the frontotemporal area. Okay? This is known as the widow's peak. Somehow, some scolding from ladies will initiate this hair loss over this area in men. Okay? The other part hair is lost is at the temporal region behind the hair. Okay? The vertex area of the scalp. So then, as you can see in this picture, the hair loss tends to merge. Okay? And then you get this fixed pattern where you only have hair in the temporal and occipital region of the scalp. So what really happens in androgenetic alopecia? The process is called miniaturization. Every time you go through one hair cycle, the hair is replaced by finer hair, smaller hair. Okay? So initially it is terminal hair or coarse hair, and it's replaced by fine vellus hair. So this whole cycle means the bigger hair replaced by shorter, smaller, 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 until finally there's no hair growing anymore. All right? So this is the underlying pathophysiology of androgenetic alopecia. So females also suffer from this case, this disease, but at a milder form. The hair loss tends to be in the middle of the scalp, yeah, the parietal region. And it's seldom that the female goes completely bald. There's always mainly thinning only of the scalp. Okay? Androgenetic alopecia in females are known as female pattern hair loss. Right. Next, I'm going to introduce another disease called alopecia areata. This is a non-inflammatory, acute, topical hair loss, or most cases it's topical, meaning it's localized to one patch. But there are people who suffer a more severe form of disease, which more than one patch. Okay? There is usually a stressor involved with this, an inflammatory process that causes the hair to be shed off from that particular area. Okay? When it involves only the scalp, it is known as alopecia totalis, when you lose hair on the whole scalp. When it involves the scalp and also the face, and the beard, then initially it's alopecia areata, but if it extends more to the scalp and the face, it becomes alopecia totalis. If it involves hair on the whole body, all the hair in the body is lost, it's called alopecia universalis. Okay? So localized area, alopecia areata. When it involves the whole head, it's alopecia totalis. When it involves the whole body, alopecia universalis. Right. Okay. This form of hair disease is more prevalent among children and teenagers. Okay. There is an immune-mediated inflammatory response that causes that area of hair to be shed off. So as you can see, these are some of the etiology of alopecia areata, the commonest being stress, but many other factors can contribute, like diet, skin diseases, genetic factors. And these are the changes. There is an attack of cytokines on the hair bulb that makes the hair bulb being shed off. If you can see on your left, the cartoon on your left shows an attack of cytokines. Okay? Causes the hair to lose its immunity and comes off. Right. Clinically, we can classify alopecia areata as patchy, diffuse, reticularis, perinevoid, ophiacis, and CCR4. As you can see, it can be one patch, it can be multiple patches, or it can involve very extensive hair loss. Okay? Sometimes when the hair is very extensively lost, it is very difficult to establish a diagnosis. So when you are in doubt, you need to biopsy to confirm the diagnosis. Right. If you were to take a slide, a histopathological picture of under the microscope of the hair, what you see is the T cells around the hair bulb. Okay? This is what pathologists call a swarm of bees. Okay? This is a very characteristic appearance that we see under the microscope in patients with alopecia areata. Okay? And this is confirmatory. When you are not sure of the diagnosis, when you take a biopsy and you see this will tell you it's not androgenetic alopecia, it's not telogen effluvium, it is alopecia areata. Next, another disease, telogen effluvium. This is a non-pattern, acute, excessive hair loss. That means within a short period of 1 week or to 2 weeks, a lot of hair sheds off from a person. Very acute, very traumatic. Okay? There is always an initial stress with telogen effluvium. Okay? The most common is postpartum, after delivery. Ladies, because of stress of handling the baby and the pregnancy or whatever, they can lose hair. Okay? I think most of you have heard of this thing, yeah? Postpartum hair loss, yeah? It is known as telogen effluvium. Pathophysiologically, what really happens here is the hair cycle. a lot of the hair move suddenly to the telogen phase and is shed off because of an underlying stressor. The patient cannot handle this psychosomatic problem, and all the hair move to the telogen phase and is shed off. Okay? Another very similar type of telogen effluvium is known as anagen effluvium, where the hair moves to the anagen phase in acutely, very acute. This one you see in chemotherapy patients where they have hair loss. A lot of hair goes into the anagen phase and is shed off. Okay? The chemotherapy cases are slightly different from telogen effluvium. Yeah? They are known as anagen effluvium. Okay. More than 25% of the hair on the scalp is lost in this case. Right. As you can see, the commonest cause is pregnancy. Certain drugs can cause hair loss in the form of telogen effluvium. I have listed those drugs here. Sometimes when you prescribe these drugs, you can get a patient losing hair. And also, chronic diseases sometimes cause hair loss. Right. As you can see the pictures here, this is diffuse, non-pattern, acute hair loss. Okay, very acute. All right. Now, we're going to discuss some regenerative therapy for the hair. Okay? One study that has been conducted by the company European Wellness is the heart or hair regeneration trial. This trial was a 12-week trial where peptides in the form of skin, placenta, has been injected into the scalp of the patients with hair loss. Okay? The indication for this treatment is alopecia areata, androgenetic alopecia, telogen effluvium. Okay? And there's another disease called trichotillomania, which is a psychiatric problem where the patient tends to pull off their own hair. Okay? These 4 diseases can be treated with this method of using our peptides. We have a specific peptides that I'm going to explain later called the hair follicle regenerator that will stimulate hair growth. Okay? This is a very do-it-yourself kind of therapy where the patient only needs to see you at your clinic or your practice once a week, and we have a DIY system where the patient can execute the treatment by themselves at home. Okay? Right. So this is a local European wellness celebrity undergoing the treatment. If you can see, this patient has very nice, thick, glossy hair. Okay? He is the living testimonial of this treatment. Right. This is the treatment I'm talking about, the hair follicle regenerator or HFR. It consists of the peptides, okay, skin and placenta and things like that. It comes also with a spray and a stamper. You can buy this as a combo to treat your patients. Okay. The hair follicle generator, the HFR, has been introduced to address hair loss concerns. Okay? You can start seeing results as early as 3 to 4 weeks. Within a month, you can see baby hair growing on the scalp. Okay? And if you were to continue the treatment for about a year, it can even help to change white hair or gray hair to natural hair color. Right. So what does our HFR do? It accelerates hair follicle growth. It promotes hair moving into the anagen phase, okay, where the hair starts growing. Okay. It increases the vascularization to the hair bulb. It also replenishes the nutrients required by the hair like biotin, amino acids, growth factors, cytokines. Okay. So this is our hair follicle regenerator. It comes in a box of 10 vials, each vial containing 2.5 mLs. Right. So what does the hair follicle regenerator or HFR contains? Basically, it contains a lot of growth factors. Okay, different types of growth factors to stimulate hair growth. Right. It also contains cytokines, and it also contains antioxidants, vitamins, and amino acids. all the requirements for hair growth. Now you know hair needs biotin. The hair protein in hair is known as biotin. The amino acids can replace whatever biotin is lost. So you can support hair growth very well. And different kind of growth factors. We have vascular endothelial growth factors, fibroblast growth factors, insulin growth factors, epidermal growth factors, many growth factors to stimulate hair growth. Right. So for the DIY component where your patient can do the treatment at home, we provide you with a stamper when you buy the combo. You fill the solution, I will show you later how it's done, into the stamper, and your patient can stamp on the balding or hair loss area over the scalp. I will be doing a demonstration later today at about 11 o'clock, so you can see firsthand how it's conducted. I just finished with the theory part. So this is the stamper. The process is known as microneedling. We create little holes under the skin to stimulate blood flow and to get an inflammatory response that will stimulate hair growth. Okay? This is the scientific idea behind, the scientific theory behind this action of the microneedling. So there's tiny needles at the length, at the diameter 0.5 mm, just enough to reach the root of the hair. Okay, it's a targeted therapy to the root of the hair, so the solution is not wasted at other parts of the hair. Okay, it goes to the targeted area very specifically. So this is how you use the stamper. You open it, you fill the solution, tighten the cap, give it a shake, and just press on to the scalp. I will do a demo later, so you will see how it's properly done. And after that, you sterilize it. One stamper can be used for 6 to 8 treatments if you use it carefully. Basically, one stamper a month. Right, this is the process how we do it. You get a hair wash in the morning, and then you apply the stamper later on, and then we finish with a spray. The spray contains the same ingredients as the stamper. It is just to make sure everywhere the medication is diffusely applied to all areas of the hair loss on the scalp. Okay? So it comes in a combo, the hair follicle regenerator, the stamper, and also the spray. There you are. This is the spray. Okay? Same content. Right. These are the results of the HFR studies that we've got. All over 12 weeks. These are the results. Now I'm going to show you other studies. This is a study from Taiwan, where this time they use autologous stem cell. It is from the same person, and these are the results they obtained over 16 weeks, where the patient underwent injections or microneedling weekly. But these are autologous stem cell. Autologous meaning it's from the own person's body. Yeah? So these are the results. And same way, I show you another study from Hong Kong. This time it's allogenic stem cells. These are human stem cells taken from another human. Okay, it's not the own person's ones, and these are the results. So you can see stem cells do work. We can use it in different ways. You can use the pure stem cells, you can use frozen stem cells, you can use peptides. It's equally good. Right, I'm going to show you another study that we have done, this time for the growth of eyelashes and eyebrows. Okay? In this study, over 12 weeks, the patient applied the topical solution of peptide over the eyelashes and eyebrows, and we found that over 12 weeks, the eyelashes grew a good ½ centimeter, 0.5 mm in average, okay, over 20 subjects, over 12 weeks. So a good ½ centimeter of eyelashes, which is quite impressive. You know, you might not need your false eyelashes anymore if you were diligent to use this treatment. Yeah. The solution contains basically peptides in the form of skin and placenta. As you can see here, eyelashes and difference in the growth. What it did, it made the hair thicker, the eyelashes thicker in diameter. It made it more luscious, more hair growing, okay? and it also made it longer in length. As you can see here, these are the results of the studies, and you can see here. If you were to observe, even at trichoscopy, this is before and after. You can see many fine baby hair growing in this one. And you can see the thickness of the eyebrows, more hair, thicker hair, okay, and also many baby hairs growing. Okay, there was an improvement in the length of the eyelashes in 83% of the subjects. Okay, we do the R&D. Once the results are good, we make the product. Okay, everything is research based. Right. Here are the publications for that study on the eyelashes and the hair. And also, I've written a book on hair diseases, if you're interested. Okay, this book is for everyone, for medical students. I give you basic sciences and basics of stem cells in the first few chapters for you to understand. For clinicians, you can have a look at the pictures and you can see the treatment options that I've added into the book, what you have, so that you can address the patients. And for the postgraduate students, I have a lot of clinical studies put in, so you can quote those studies. So if you're interested in this hair, and I think everybody should, because this is a multi-billion-dollar industry. So if you commit to this, yeah, if you'd like to know more, it's available outside. Okay, the conclusion is we have many options for hair treatment. It's not just the FDA-approved finasteride or minoxidil. There are many, many different regenerative approaches where we use cells to cure the problem. Okay? For your patients who don't believe in synthetic medication, who don't want to take drugs, this is a good alternative for you to consider to treat hair loss. Right. Thank you. Yeah.